Welcome back to something that is a huge topic in today's society, mental health and youth services. Young people today face unprecedented pressures, from cost of living crisis to social media to academic stress and family instability. Yet the services designed to support them are stretched thin and often difficult to access. So this session will ask, how can the public sector better support young minds? We'll look at systematic challenges in youth mental health provision, opportunities for early intervention and integrated care, the role of schools, councils and voluntary sector partnerships, and how to co-design services with young people themselves. This is such a huge topic. Should we start with what Australia has done in banning social media for under 16s? Is that the way forward? Kevin, do you want to start?
Well, one thing, I was in Australia when it came into fruition, and any government wanting to get the votes of voters it would be an excellent initiative politically, because the ratings of the government in Australia soared after they implemented this initiative of banning all social media for under 16s. Of course, some very clever children have bypassed it, but those are minority. And they think that they've had an impact on about the vast majority, about 80% of children have managed to stop using social media in the way they were using it before. The most dangerous sites are those sites geared at adults that they access, which can contain sexual violence to others, torture, images of suicide and execution, and all those have an impact on the mental health of these young people, as has research shown. And so I'm an advocate to follow Australia's lead in the UK as soon as possible.
Lucy?
I think it's a really tricky one. I think for me, my concern is that it polarizes things a little bit. I think as Kevin identified, I think people are bypassing it. And I think if you don't have parental controls and team controls in place, when children are accessing the internet, what they're doing is accessing it with the internet believing they're 18 and up. And it's what the algorithm then allows them to access and then sends their way. So I think there's perhaps a balance to be had. I also think if we've got parents working with children on their phones and what they're accessing, it's much easier to do that at a younger age. Whereas if we don't let them near the internet until they're 16, 17, 18, and then suddenly let them loose, that's quite a lot all at once. So I wonder if there's some form of middle ground to be had between a complete ban.
Sam, what's your view?
I'm probably going to agree with Lucy that I think it's a really tricky issue, and that if I understand we have to have some limits somewhere and go, this is the time when children are definitely too young. But I think adolescence is a time of inquiry, and some of that is really, really helpful. And the information in a positive sense that's available on the internet is really good to get at. I think we have to tool children up to be discerning readers and have better monitoring and restrictions placed on the information that is there, that we hold the big tech companies to account for increasing their ability and their responsibility to ensure a safer environment for all tech users, not just children.
Lucy, I was listening to an interview with Ian Russell, Molly Russell's dad, yesterday, who's obviously, been working on this for some time since his daughter died by suicide. And, he was saying that every time there's a bad bit of publicity, the big tech companies will come out and say, we've done this, but actually it's pretty flimsy, that it doesn't stand up to scrutiny, and that it's so easy to get round those kind of structures. And, I'll hold my hands up. My son knows an awful lot more about phones, laptop, all the rest of it than I do. You talk about working with parents. Are we almost beyond that already?
I think that's the main issue. I think that we didn't grow up in this world where phones are just part and parcel of life. And AI, for example, you know, the awareness around what your child is using AI for example, that can make a really big difference in your child's use of the internet and their use of those sorts of apps. And I think one of our big problems is educating parents in a world that changes every day. You know, we see it in the schools. We see schools, you know, teachers are under so much pressure, but actually we're expecting such a lot of them to keep up with this world when every day we wake up to something new. So yeah, it's an uphill climb, but I do think that educating parents in helping to support their children in using the internet in more positive ways can go a long way to help.
Kevin, yeah, sorry, go on.
There are a number of points I want to make. The first thing is, don't rely on the tech companies to do anything. I mean, there was a very simple introduction of age verification for pornography introduced into the UK recently. Only those European porn sites have adhered to it. Anywhere else in the world, you can still access pornography without age verification. They've not really, can't even manage a simple thing like that properly. So, the only way you're going to twist the arm of tech companies is to have an outright ban for under 16s, and then because they want money, they will design internet services for children. But they don't have to at the present moment because we've not had that ban. They've not geared the internet for under 16-year-olds because they've had no necessity to do that. So the way we can force the tech companies to do things is to control them legally. And that's why I think Australia, out of desperation, has done what they've done. The second thing is that we talk about parents and parents looking after their children in what they view, etc. We know that children who are delinquent and commit crime and have mental health problems come from disorganized families that are broken down. They don't come from middle class, well-educated families that sit their children down and talk to them about what the dangers of the internet are. Vulnerable children are groomed daily to the extent that we have 140 police officers pretending to be children online to catch them. And so we can't rely on parents of those vulnerable children that we're most concerned with, those that are likely to have mental health problems and commit delinquency and crime, for the parents to act. So we have to act as a society to help those parents and also legally control the internet services. And that's why I agree with the Australians. It's only our desperation with the internet services and tech companies that they've taken this step. But that will make the tech companies think and develop more child-friendly internet services.
Nadia McDermott asks, the solution is not banning social media as young people find other ways in the music and games that they consume. What are schools doing to teach parents on what to look out for? How are schools dealing with cyberbullying? Is it much different to bullying that happens within the school grounds? Sam, Lucy, would either of you want to pick up on that one?
I mean, I am by no means an expert on the media, but I think as we all know, the problem with cyberbullying is it doesn't stop at 4 o'clock when you get home; it just continues. So the extent of the harm that can be done is much more profound because there isn't a safe place to be. I think the difficulty with total bans, and I take Kevin's point, well made, is that if we make something illegal and wrong, we also stop children being able to ask for help very well because they think they're going to be in trouble twice. And I think it's a wider issue than simply what happens online. So I also take Kevin's point that often, vulnerable children live with vulnerable adults, and abuse and neglect and exploitation don't stop on people's 18th birthdays. So if we're thinking about this as a wider issue, we need to think about the whole kind of societal response to what we do with vulnerability and harm, because at the moment we're not doing very well. So we have mental health services for children that I would argue are incorrectly commissioned, because they're commissioned in a very narrow way to risk assess, risk manage, and emotionally regulate, whether that's through CBT techniques or medication. But they're not invited to be creative long term or engage with the entrenched kind of problems that children and families may present with across the piece. We have lost very many services that did early interventions like Sure Start, but also detached youth work. If we think about child exploitation, the you know, and the use of knives in society, etc., young people who are disenfranchised, that also coincides with a very big kind of cut in services in that early doors, supportive kind of context that could have meaningful help to provide meaningful change. So I think there are things we can do in terms of the internet, and as Kevin says, you force big tech companies to change as and when they can. But I think there is also about how we think about the whole context and how we support not just children, young people, but also the adults who are also vulnerable and who care for them.
Lucy?
So in terms of cyberbullying, banning social media won't change that. They're not looking at banning things like WhatsApp. They bully each other on the Google Chromebooks, on Google Classrooms. They communicate that way. They communicate on Spotify. They communicate on gaming sites. We can't say that by taking social media away from them that we're going to stop this. So it's not an answer. We have to do better, and that comes from all of us. And to be honest, that comes from people like us who are working in this field, because as I've said, I think it is too much to expect teachers to have that kind of knowledge around it all. But definitely, you know, they live in a world where they're online and they're offline. They blur together. And so what we're seeing online bears out in the playground when they're face to face and in their extracurricular activities. To them, there is no online and offline. It's just their life. And I do think our generation have to start to see it that way and understand that taking things away from them won't stop it taking place. They will find a way to communicate. So the issue is around the fact that, you know, kids out there want to commit cyberbullying, not the ways that, not the platforms they've got to access each other, because they'll always find a way.
So, Kevin, you talked about the stats for young people in terms of the background they're coming from. How can we help? How can we intervene earlier in people's lives to help them so they don't want to go onto cyberbullying, they don't want to go onto violence, they're not looking maybe for these kinds of things, or if they do see them, they can filter them better. How can we improve early intervention?
Well, I think we've already alluded to the importance of Sure Start, which is supporting parents with children under 5, advocating home visitations by health visitors to promote positive parenting programs, especially with vulnerable families. All those we know works. WHO, UNICEF have advocated it. Even the states have introduced it because they didn't have a home visiting service, and now they've got one, or in some parts of the states, because of the impact on the life trajectory of getting it right for the under 5s. Once they go to school, we need safety school programs. Our research in Warwickshire with the Warwickshire Police in the schools of Warwickshire found that 18% of girls were molested by their peers. So we're going in the wrong direction. And all the Labour Party appear to be doing is making cuts, which is very short-sighted, because all that means is a great deal of expenditure down the line because we have no prevention services in place.
Sam, do you want to come in?
I agree that we have to, none of this is rocket science. It is really simple. We do need the provision of early help services targeted at different age groups that are supportive of vulnerable families, because as we know, in the families that can have those conversations where you have parents who are relatively together, then children will be less vulnerable to some extent on the street or online, because they at least have somewhere safe to go home to. It's the ones who don't have safety anywhere, and those opportunities to support people have fallen. And we know that, for example, when we had lockdown and people couldn't go round to people's houses, or children couldn't access services, for some children that was extremely frightening, because there was nobody putting checks in on abusers. So we know that we do better when we have real relationships with people, when there are people out there that children can build trust in. So whether that's a police officer, whether that's a detached youth worker, whether that's a teacher, but there needs to be we need to be in people's lives in order to support them with their lives, I think, not just online. And I think we villainize, that's word my mind's gone blank on whether it is or not, the internet, at the same time that we are pushing services ever more onto the online space. We've forgotten how to meet up in person, and I think that is far better for everybody if we can.
That certainly plays into a question from Sophie Large from Family Action. She says, how do we change the funding focus from quantity to quality? My services offers long-term relationship support of 2 years, but increasingly we can't compete with services that can get a lot more young people through the door. We often hear from our young people that they're sick of being passed around like a parcel. That is very much the point you're making, isn't it, Sam? That, it's not a quick fix necessarily.
It can't be a quick fix. And what we've got to stop doing is sending children to multiple people. So you will have, you may have a missing from home person, you might have a social worker, you might have a mental health person, a drug and alcohol person. You may have very many people, and we know when there are multiple services involved in children's lives, that the outcomes are likely to be more negative than if there is one trusted adult. So we have to invest in supporting practices where you can have a trusted adult. You may have a team around that adult, that professional, rather than the team around the child. So we're not expecting children to consult. And as the person has written, we need to look at how we commission services, because if we commission simply to manage the headline problem, all we get is people coming back and coming back and coming back, but we don't do that cost benefit analysis over a long enough period and across a range of services. And Kevin will know more about how you do those kind of assessments than me, but we don't do them enough, and then we end up having a revolving door. And it's, if we want to be trauma informed, and I think we do, we have to understand people in context, their whole, biopsychosocial context, so who they are, at what age and stage and ability they have, and their cultural context in terms of all of those different worlds in which they live, online, offline, at home, in school, but and their own personal backstory within that. But we have to find a way of investing in services that can do that long-term work, and some of that has to be about how we make sense of cost and benefits of doing that, rather than the piecemeal stuff that we're invited to do at the moment.
That's the thing, isn't it, Kevin? Actually, early intervention, if you can be trauma informed, trauma responsive, you can, down the line, save a lot of money, but more importantly, improve people's lives immeasurably.
Exactly. And I just want to emphasize that this research and this science we've known for 80 years. A little bit of homework for listeners: if they go away and listen to Dear Officer Krupke out of West Side Story, just listen to the lyrics and you'll know how much we knew then. 80 years ago, Stephen Sondheim wrote that. And nothing has changed. We still make the same mistakes 80 years on. And it's really telling that we knew so much 80 years ago and we've done very little about it in terms of safeguarding children's lives.
So, Lucy, that there is a huge demand versus capacity problem, isn't it? Mental health services for young people is a really pressurized system. You hear so many stories of people just not being able to access them until there is an absolute crisis. How do we work towards a better integrated system?
So I have seen a bit of a shift towards more being available online, and I think a lot of children and young people welcome that. I think they're quite au fait with the online world. Things like Shout, they can text when they're in crisis. They type. They don't talk. How often do you see children and young people making a phone call? They might voice, they might be videoing each other, but they love to text. So Shout is a really accessible one for them in a time of crisis, and they refer on. They're really good with the resources. They will refer you on to longer term services. I think.
And can they get those longer term services when they are referred on? Is it like that? Is it an immediate thing, or is there a huge waiting time?
So a lot of them are things like apps that they can use and actually learn to try and regulate their own emotions, which again it's a way of empowering them to help themselves in the moment. Things like online counselling, is much more accessible now and a lot easier for some children to access because they can do it over their phones. They can reach out. School counselling services, I think there should be so much more. We've talked a lot today about vulnerable children, but a lot of the children that come through my door, they wouldn't be in that vulnerable bracket and probably wouldn't ever reach the threshold for counselling or any of these support services. But actually, what they're doing online is affecting their well-being and could have a long-term impact on their mental health. So for me, it's about picking up those children in the middle who need support, could use that support, but aren't getting it from anywhere and aren't being offered it. So they're not even on a waiting list for anything because they're falling through the cracks. So for me, that's the bracket I'm looking at and thinking, what can we do to help them and support them?
Sam, did you want to come in?
Yeah, I mean, I would advocate for a complete radical overhaul of the entirety of mental health services, and I would move medicine from the centre to the periphery and put formulation or a needs-led kind of analysis at the centre, because then those kind of thresholds stop being to some degree arbitrary. So one of the things that always I struggle with is when people go, oh, that's not mental health, that's behaviour. Well, any behaviour has a mental health reason behind it, whether that's I'm having fun, so I'm smiling. I'm smiling because I'm having fun. But it's that distinction between what is a mental health issue and what isn't. So I think we have a much more relational understanding of it. You implement some form of trauma-informed commissioning that takes a functional analysis and understands people in context, because at the moment an enormous amount of money goes to big pharma. Our dependence of psychoactive drugs has increased unbelievably over the last 20 years, at the same time that both children and adults' mental health, self-reported mental health, has decreased. So we're investing in a system that doesn't work particularly well. And if we rethought our mental health services, we may have more money to jig around into doing different things. So that isn't to say that medicine, psychoactive medication, doesn't play a part, because it can be really helpful. It just can't be the central organising principle when we're thinking about people in context.
Kevin, do you want to come in as well, just before I move on?
I'd like to support that. I mean, I'll give you an example that we know that children who grow up in neglectful environments or in residential care develop autistic behaviors and are often labeled with autism. But if you put them in foster care for 6 months, their autistic behaviors disappear. They don't have biological autism. They have acquired autism or pseudo autism. And similarly with ADHD, children who grow up in violent families are often hyperactive and lack attention and concentration because of their trauma. Again, the wrong approach is just to label them ADHD and give them Ritalin. The idea is to look at the causes and to see if we can do something about it behaviorally. And we know if ADHD begins to wane or disappear, then they're not biologically hyperactive or biologically inattentive. And so it's only by formulation and not the immediate use of medication that we can sort these matters out. And we waste vast amounts of time and energy labeling people and not really investigating the true cause of their behavior.
Lucy, I think you pretty much addressed this, but I'm just going to see if there's anything else you wanted to add. Nadia McDermott asks, there's a lot of support for young people that are in care. How would you suggest counsellors encouraging young people who are not in care to ask for help? Childline can often be seen as a not to do in cultures. How do we ensure that youth hubs remain, regardless of budget cuts, to help the community and young people out of trouble?
So I think that, as we've spoken about, I think there does need to be more for people who are, I would describe them as sort of falling through the cracks, because yes, they are accessing things online. A lot of the time parents are unaware of what they're accessing, so they might notice changes in behavior. School might notice changes in behavior, but the reason behind it might get missed. And it's hard to parent, because you can be as intrusive as you like, but in a world of one-time views and voice messages instead of text messages, it's very, very hard to actually, unless you are lifetime monitoring, see what your child has seen and accessed. And we all know the impact, once they've seen something that has had an impact on them, we know what that can do to them in the longer term. So I would like to see more offered to them. I think the online world gives us that capability. We are overstretched face to face. It would be lovely to say everybody should be allowed, face-to-face counselling for all children and young people, and I'd love to see it in all schools. But in a world where that is looking hard to do, why don't we use the online world more? Why aren't we making it more available? And yeah, I think for me that's where the answer may lie.
Kevin, are we putting a lot on schools and a lot on teachers at a time when they've got an awful lot to deal with anyway?
Yes, as I say, the early intervention is the most effective. The longer you leave it, the less effective it is. So when we're trying to turn around delinquent behavior in a teenager, it's a tall order, because we've got years of disorganized thinking, distorted thinking to address. So the earlier the intervention, the more effective. This is well established. Also, the care system is failing. We need much more foster care orientation, and we especially need foster care for those who have been convicted of an offence, rather than placing them in a young offender institution or a children's home, because all they learn from other delinquent children is a criminal career. We also are taking away the liberty at a time which is critical in human development, around 10 to 14 in children's homes and 15 onwards in YOIs. And so we really need to rethink what we're doing to these people. And the Scandinavian approach is much more preferable, where they're more likely to be fostered into a family which has been trained specifically to deal with young offenders. And I think that's the way to go. The care system just doesn't work at the present time. And what we find is that children are more likely to be delinquent, more likely to go missing if they're from a care background than a non-care background. And I also like to point out that only 50% of children who go missing ever get a return interview when they're found. Half of them aren't even interviewed. They're just returned to their family without any investigation.
Stephen Beach says, I'm in support of the restriction of some material apps to be accessed via mobile phones. However, it would seem that there's a lot of engagement via online gaming. Although the purpose may well be for enjoyment and entertainment purposes of the child, they can become engaged with others who could potentially radicalize or promote negative behaviors. Do the panel think the ban should extend to online gaming? And should this be more regulated and parents be more accountable with regard to control via their internet router options? Lucy, I'm going to come back to you. I mean, that easier said than done, it strikes me.
So it's hard, isn't it? I some of that, yes, I agree with. So I think the main issue with things like Fortnite is who they might speak to if you haven't got the control set, that they're only talking to their friends, but also that they try and off-platform them onto things like Discord. And Discord, I believe, would be covered if the ban came in. So it would take away the risk of them off-platforming to things like Discord, yes. Roblox is a really hot topic at the moment. I'm sure any parents out there who have preteens will be fully versed in the risks. I think there's a lot more we could do around Roblox, but gaming is huge. Things like Super Mario, Mario Kart, they have existed. FIFA. You will always have people trying to make contact with preteens on these platforms because they know that preteens' place to meet up is where they go before they're on phones and social media. But again, I come back to, that's why as parents we have to be intrusive around it. Set those privacy settings, use those parental controls, shut it down so they can only speak to people who they are speaking. Make sure they are gaming on the big screen in a family room, not wearing a microphone, so that you can hear who they are talking to. Is it annoying? Yes. But, are you intrusive? Do you know what your children are doing? Yes, you do. So do I think we can take gaming away from them? No. Do I think we could be a little bit more cautious around some of the gaming sites? Absolutely.
Kevin, you come back to your point. If you can ban social media. Do you ban gaming? There are other avenues, aren't there, for be it big tech companies, be it people who want to put stuff out there that we would rather our children didn't see. There are ways of getting at kids, aren't there? Sorry, that was to Kevin.
Oh, sorry. This has been a battle since the 1980s when gaming first came about. We have had European bans on games. There was one game that was where you tortured a child. That was banned throughout Europe by the EU. So it's not that games can't be banned. They are sometimes banned but the threshold seems to be very high. And other games allow what we call skinning, where that you can put a picture of your boyfriend or your girlfriend on the image and then do all sorts of things that you might want to do to them, including sexual violence. So these sorts of games and allowing images to be put into the game can be controlled and should be. So we need much more control over games to make them more child friendly. And censorship is possible, and we have done it in the past, and games are rated. But as I say, both in cinema and DVDs and games, our sort of threshold seems to have been affected by community desensitization. What we allow now to be readily viewed wouldn't have never been allowed 20 years ago.
I've got several questions that have come in about porn and about sexual behaviours. This from Matthew Hudson. Harmful sexual behaviour is a massive concern, especially from peers. How can we utilise the National Men's Health Strategy to leverage support for our young men at population, place and individual level? The lack of services is being felt. What priorities should be making, and unapologetically? Kevin, does that play into the point that you were making there?
Yes, and it plays into the point of what we're discussing about mental health. Pornography is addictive. It's a strong addiction, and can be as compelling as things like alcohol, smoking. You get addicted to the images that you're seeing, and of course the images then, just like addiction, aren't enough for you, and that's when some children and young people drift into things like child pornography because of the the, the image that they're viewing initially, which are adult models, isn't stimulating enough, so they drift downwards into child pornography, or they drift into violent pornography. And so it's extremely important that we deal with pornography in a mental health way. Um, Relate the marriage, the relationship and marriage organization already has men's pornography groups because it's affecting their marriage, affecting their relationship. And where the couple want to remain together, the man can go to these groups run by Relate and talk about their addiction to pornography and how it's affected their lives with their family, and try and get some way out. For child pornography, it's, as you know, against the law, so it's less available in terms of treatment. But the Lucy Faithfull Foundation in Epsom run groups for men that feel they've become addicted or getting close to addiction, of looking at teen sites and child sites. And the Lucy Faithfull Foundation help them with that addiction. And they often get referred from court to that service. So there are pockets of services out there, very patchy. And what we need is it rolled out on a national basis, because so many men are viewing pornography and becoming addicted to pornography, which is ruining their lives, their families' lives, and their partners' lives.
Sam, Kamala Coogan has made a point about her council asking 11-year-olds about whether they view porn. They hadn't sought consent, apparently, from the parents to ask this. Some didn't know what that meant. Now they go and find it, don't they? If you get asked the question, how do you deal with children without informing them to a certain degree, and that, but also trying to find out what it is they are accessing, and actually giving them information to go and find things that you'd rather they didn't?
So if we're talking about how we talk to children, you talk about the thing rather than give it a headline. So so the safer relationships that the NSPCC developed a program for primary age children, you talk about what is safety, what does that mean? You can then talk about safe people, safe places, safe touches. You don't have to give it a label. You don't have to say, we're now going to tell you about sexual abuse. We're now going to tell you about pornography. You talk about the thing. And that's just about, pictures that you might see that might make you uncomfortable. So you talk about the thing. But I would also say that that definitely pornography has altered a generation's understanding of what sex is, and this is a problem for both boys and girls growing up. That I know some people have set up a charity specifically around strangulation, because there has been an increase in women being strangled, and that is tied very much to pornography. And I think that we need to be careful about how we have these conversations about potentially difficult things with children, in terms of the way we can be traumatized in different kind of forms. So we can have primary traumatization from experiencing stuff. We can have secondary traumatization from talking about it. So we need to think about how we talk. Are we talking in the right way? And in terms of compassion fatigue, we can have cumulative effects of listening to that stuff, and how that impacts workers as well. So how we keep being supportive. And I just wanted to go back to taking this to a wider place. One of the proposals that is coming forward at the moment is to set up independent child exploitation advisors in a similar way to established ones around independent sexual abuse advisors, sexual violence advisors, independent domestic violence advisors. And this would be to do some of that early work, whether online in real life, to support that wide mass of young people where there may be some kind of move towards unhealthy, not right places in a whole range of kind of child exploitation ways, but without them reaching those thresholds that exclude people. And I would just say there was a very small comment saying that children in the care system access mental health services. I can tell you, as somebody who works in those services, they do not. And what they are offered is not fit for purpose, because it is about managing them. It is not about understanding them. So they are as poorly served as people who don't reach thresholds. Yeah.
Lucy, I wanted to come back to something that you said earlier of we must do better. Millie Smith says, as a society, is it important we set an example? How can we expect young people to believe bullying is wrong when even beyond social media, the media are creating as adults, and we are consuming, is often based on bullying? The culture of newspapers, magazines, gossip channels are especially focused on bullying. We sort of see the heckling in Parliament and all the rest of it, don't we? There's a lot of shouting and division going on.
I couldn't have said it better myself. I think we currently model this cancel culture to our children, and it has to change, because we didn't grow up making our mistakes online. We grew up in a generation where we could make our mistakes, and they haven't affected us in later life. But our children are making those mistakes online. Those mistakes are kept, they are screenshotted, they are kept, they are used against them. We have to start modeling forgiveness and accepting that these mistakes they're making online are mistakes. And if we start practicing that forgiveness ourselves, instead of modeling this cancel culture that is, we're so quick to come across, aren't we? And then we can make real change.
Just before we go, because we are running out of time, Sam and Kevin, are you happy for us to pass on your contact details from to Camilla Kingston?
No problem. Yeah.
Just finally, Sam, can I just end with you? Do we need a better national policy, do you think, on trauma, identifying it, processing it, which will filter down, hopefully, to those child services, youth services and beyond?
I think that would help, and I think some attention paid to those transitional times in terms of moving from childhood into adulthood, and how we join up services across time as well as across the piece. But certainly a better understanding of trauma and putting it at the centre, moving medicine to the periphery, would help.
Thank you all very much. It is such a huge topic. I'm not sure we stayed on topic in terms of what the title was, because it is so big, it is so broad, and there are so many issues that you are all dealing with. So thank you so much for your time and your insights today.